Yoked prisms and cerebral visual impairment. The processing of visual information around us involves two systems, namely the ventral and dorsal system. The ventral system answers the what, that is, identification of people or an object in a person's environment. On the other hand, the dorsal system answers the where, that is, perception of space such as movement, depth, and position of one's self in an environment. The ventral system is also known as the what or focal system, and the dorsal system is also known as the where or ambient system. Cerebral visual impairment leads to damage of these visual processing centers, leading to perceptual visual problems. Children with cerebral visual impairment present with a wide range of symptoms including inaccurate movement in three-dimensional space, inability to handle complex visual data, which makes them to take closer look at the object of interest, inability to differentiate floor boundary, uneven surfaces and steps without prior exploration, inaccuracy in reach and grasp, and colliding with obstacles. Superadding to these functional visual problems would be a poor visual acuity and visual field impairments in varying combinations and intensities. What are yoked prisms? Yoked prisms are a pair of prisms of equal power placed in front of each eye with their bases oriented in the same direction. They optically induce a change in the perception of one's space, that is, the ambience, and hence it is also known as the ambient prisms. But how do they achieve this? When on, yoked prisms cause the following. First of all, they cause field displacement towards the apex. Secondly, they cause a non-uniform magnification across the field. That is, the objects near the apex appear magnified while the objects near the base appear minified. They also cause a midline shift, thus affecting a person's center of gravity and helps changing the person's posture and stance. As yoked prisms are capable of reducing the behavioral consequences of perceptual visual dysfunction, they have been employed in children with autistic spectrum disorder, where a dysfunctional ambient system is reported to affect the attention, orientation, and result in a poor eye contact and a poor visual motor coordination. Yoked prisms are also employed in neurorehabilitation following acute brain injury, where the patient might suffer from visual neglect, hemianopia, and an abnormal egocentric localization. With the following videos, we wish to demonstrate the implications of yoked prisms in children with cerebral visual impairment. This 5-year-old child with consequences of periventricular leukomalacia shows no spontaneous mobility when encountered with a new environment, along with a poor hand-eye coordination. With 4 PD base down yoked prisms, she actively explores her surroundings and is aware of her lateral supports. Her reach has also improved. This 7-year-old kid with perinatal hypoxic insult shows difficulty climbing downstairs, which may be due to impaired inferior field awareness or optic ataxia, along with a poor obstacle negotiation. With 4 PD base down yoked prisms, his ability to climb downstairs and obstacle negotiation shows marked improvement. Similarly, this child prefers to take a closer look of an object of interest along with poor hand-eye coordination. During her rehabilitation therapy session, she is provided with yoked prisms of 4 PD base down, which improved her grasping ability. Thus, yoke prisms can be an effective modality to improve mobility, balance, and grasp by improving visual perception in children with cerebral visual impairment. This takes them a step closer to being independent and provide them with better appreciation of ambience and quality of life. Thank you.